Hi everybody, I'm Jerry Ridioff and I'm from Links Grove, the Durham, North Yorkshire area. I'm joined today by Rob Huckins, who's from the Huckins Family Appeal, and we just want to have a chat online basically about Lyme disease and raise a bit of awareness as to what that is. So come and say hello, Rob.
Hello.
Another quick hello, that one. So we'll get sort of straight into what Lyme disease actually is, where it comes from, and what the symptoms are, that sort of thing. If you're happy to share that with us.
Yep, sure. Lyme disease comes from infected ticks that you can get from grassland and moorland and generally anywhere outside. Not all ticks carry Lyme disease, but there's a proportion that is. If you get bitten by a tick, normally within a week or so, you'll start getting certain symptoms. Not always, but classically is a big bullseye rash from where the tick bite was, which is an indicator. And then a week later, you might start getting flu-like symptoms, joint aches, and fevers, and a whole host of different things.
So it's like a round rash, then you're saying?
Yeah, it literally looks like a bullseye. You know, it's kind of, can be small, can be large, but it's an obvious ring around where the bite site was.
Right. Could that be mistaken for just, I don't know, a midgie or mosquito bite, or is it very prevalent? Is it very different?
People who know what to look for, it's obvious, but people that don't, yeah, it can be put off as any sort of bite, really.
Right. I'm just thinking for something like that, it would be quite easy to just go and get some Savlon or antiseptic or whatever and put it on, thinking that you're treating just something quite simple.
Yeah.
Yeah. Right. And at what time scale did you say there for when things start to...
5 days, I think, is to 2 weeks. You start developing symptoms if you've got the bacteria.
Right, 5 days to 2 weeks, basically.
But the problem is, there's not just Lyme disease; they carry other diseases as well.
Ticks do.
Oh yeah. They call them co-infections. There's various different parasites and other bacteriums.
Right. Okay. So do ticks naturally have this, or do they pick it up from other animals?
No, they get it from animals basically. So like anywhere there's deer, sheep ticks, anything like that, they just pass it along basically. But not all ticks have them, obviously. But
yeah. Right. I didn't know if that was a bit of a random question, to be honest, but it was just to get my understanding of it more than anything.
That's the bloodsuckers basically. Ticks that don't have it, if they suck on an animal that does have the disease or diseases, they just pass it on, same as mosquitoes do in malaria.
Yes, right. Good. Yeah, good point. Like I say, not all of them have got the disease. It's whether they've got it to start with. Right. Okay. So, in terms of symptoms then and treatment for Lyme, can you give us a little bit more information on that?
Yeah, if you can treat with antibiotics, standard NHS course of antibiotics is 2 to 4 weeks, and if you've only got the initial symptoms, 90% chance you'll clear the infection and you'll be absolutely fine. However,
right. It's a really, really tight time scale, though, isn't it? I've written down there, if you get 5 days to 2 weeks for the onset of the symptoms, but you would need a course of 2 to 4 weeks antibiotics.
I would say minimum 4 weeks myself.
Right. And what about from 4 weeks? Did you say, I remember us talking before, and you said that's basically when the symptoms start to get progressively worse?
If you've not been diagnosed or you've been misdiagnosed and you don't get any sort of antibiotic treatment, things can get considerably worse symptom-wise. The actual disease itself, they call it a great imitator. It imitates other diseases, so you might suddenly get arthritic problems in your joints and your knees and things like that, or you might start getting migraines and meningitis type symptoms. It could be anywhere wherever the bacterium is, and again it can be misdiagnosed as you could have meningitis or you could have arthritis, and it's not, it's the bacterium. And again, if you treat with the antibiotics, your symptoms should clear up, but the longer you leave it, and the worse the symptoms will get and the more difficult it is to treat.
Okay, so I suppose with that then, basically, if somebody has had a bite and it comes out in that sort of rash, it would be the best move to get down to see a doctor as soon as possible.
Go see your GP. Yeah.
Yeah. Can they then? What's the likelihood of them being able to diagnose that?
Well, what they should do is they should take a blood sample, which they can send off to test for Lyme disease. But in the meantime, they should put you straight on antibiotics, 4-week course straight away.
So,
As a
but
precaution.
if somebody suspected that that's the case, then they might have to be quite forceful with the doctor to insist on those antibiotics. I'm just sort of reading between the lines. If it were me, I'd be thinking, well, if you've only got a tight time scale, the doctor's probably not going to be able to identify it. Hi, I'm Jerry Ridioff, and I'm back joined with Rob Huckins, talking about Lyme disease. We've covered a few items already, but we'll launch straight back in if that's all right, Rob. Want to
Yep.
say hello
Ready?
again? Lou. So we got to talking about actual diagnosis and the timescale, how important it is to try and get those antibiotics quite quickly in a timely manner. Now, I want to ask you a bit more about treatment. So you said if you get in early and get antibiotics, it
Yeah.
can be completely cured. What's
Yeah.
the process after that? Because as far as I'm aware, it's not really available on the NHS, whatever
Yeah,
you
it's
need.
the protocols they use. Once you've had 4 weeks worth of antibiotics, that is what it states it is in the book is used to treat Lyme disease. So if you have symptoms after that, or you have recurrence of symptoms, no matter how bad, they will say you now have post-Lyme syndrome, which means they say it's damage from having Lyme, but you haven't got Lyme anymore. However, people who have had extended antibiotic treatment got a lot better and become cured. But the only way to get that is private. You won't get that through the NHS. Once you've had your 4 weeks, that is pretty much it.
That's categoric then. After the 4 weeks of treatment, you've got damage that's been caused by Lyme, but
Yeah.
not identifiable to then treat it.
So all they'll do then is treat you for the symptoms. So if you've got pain, they'll give you painkillers, so on and so forth. If you've got mobility problems, they'll give you, everything to treat symptoms, but rather than causes.
I was going to say that's the old saying of treating the symptoms rather than the cure. Is that the right saying?
That's pretty much how it works.
Yeah. Right. Okay.
The only way to get any more treatment is to go private.
Right. Right. And going private in this country, is that an option?
It was. We initially went private. Went to see a doctor who worked in the field, I think it was. But he retired not long after they went into treatment. Then we looked around the country. There are other places you can go, but they're very expensive, and they tend to not have the information that the American and German doctors do. And we did a bit of research. So we looked at going to Germany, which is where we went first, and we took our daughter because she was displaying symptoms. And they know what they're doing. The only problem is, with it being German, the English-German barrier for language is quite difficult.
What's that? Sorry, I couldn't hear you properly then. The
So
English to German.
Germany made it quite difficult with them speaking German and broken English, and us not speaking German at all made it quite difficult. And the other problem we realised as well, when you pay for treatment, you pay extra for an English translation.
Right.
So it was working out quite expensive. So that's when we looked at going to America, which is what we do now.
Right. Okay. So when you recently went to America, didn't you? To get Adele treatment. Now, obviously, there's 3 children which we've not sort of talked about just yet. So the treatment that they give in America,
Yes.
what does that basically consist of?
It depends. It's all individual. Every patient has a different regimen, but because Dell had been on quite a lot of treatment already and made a fair amount of progress symptom-wise, they decided to put on IV antibiotics.
Right.
Obviously, with us being over there, it was fine while we were over there, but it had to continue when we came home. So she had to have a PICC line put in, so it was intravenous into the heart.
Okay. Right. Right. Enough.
Now she can self-administer the antibiotics herself without needing a nurse all the time.
Right. And presumably you had to get those home as well on the flight when you came back. Is
Oh,
that
we've only been so much to be back on the flight because of the weight limits. The rest we had to have posted to us from.
right. from from America separately?
Yeah, yeah.
Yeah. And was that really costly as well?
Yeah, and the drugs themselves, some of them are expensive, some of them are cheap, but it's the postage is expensive. But I mean, we just had a Skype not long ago with a doctor, and he wanted to go on something called Mepron, and it's what, between £600 and £700 for a 4 week course. So some of it's quite expensive.
Right.
Uh,
So it might have been cheaper just to book another seat on the plane, would it?
no, not quite as easy as that, but
So, one of the things as well, he said that there's basically two tiers in being tested
yeah.
in the
Standard
NHS.
protocol for testing for Lyme disease, yeah. First one's called the ELISA, or LISA, and the second one's called the Western blot. And the Western blot, no test is accurate, totally accurate. The Western blot is more accurate than the ELISA, which is the first tier. Probably
Right.
won't do the Western blot until you get positive on the ELISA. But the sensitivity for it, from what I can gather, is anywhere between 20% and 80%. But generally, as we've after speaking to other people and our own NHS consultant, if you are negative on the ELISA, you don't get the Western blot, you don't have Lyme disease. If you get positive on the ELISA, you don't get the Western blot because the says the false positive. So you ain't got a chance, basically.
So that's really confusing for me to understand.
I mean,
To understand. So if you get a positive, they then test it to do a second test.
if you push for it, yeah, yeah.
Right.
I mean,
Okay.
but really, it's only any use if you've just been bitten. You've only just got the symptoms. If you've had it for a long time, and all these symptoms for a long time, those 4 weeks of antibiotics ain't going to clear it anyway. So it doesn't matter whether it's positive or negative. You're not going to get any more treatment than the standard 4 weeks.
In the UK.
Okay.
Right. So you did like the time scale of actually getting tracked, getting it identified and tracked that's really it's about as tight as it could be, isn't it, time wise to get a diagnosis and treated.
Yeah.
Yeah. So one of the other things, obviously, we've mentioned about there's no real alternative than having to go abroad, be that the US or Germany. So obviously that's part of the reason for raising awareness and also the fundraising, isn't it? That's basically to cover nothing more than just to get treatment.
Yeah.
At the moment, yeah.
Well, go on.
Hey.
Carry on.
All right. Watching you. We'll have to edit this anyway. You keep scratching your armpit.
I know, I've got it. Eczema in my armpit, I can't help it.
You've got eczema?
Yeah.
Right, so one of the things that struck me is it's actually, it can be passed down to generations through children. Do you want to tell us a little bit about that?
Well, yeah, there's no guarantee. What it was, after we went private, we had to start doing our own research, basically, and there's some top doctors in America, and quite a few of them were saying that there's a good chance it can be passed congenitally to your children, even partners through sex. No, there's no real research gone into it, so no one really knows, but they're saying it's quite a good possibility that that's the case. And we've noticed that our children have like odd little symptoms that have been going on for quite some time, and when we took them to the NHS and standard doctors, they just basically pass us off as being paranoid parents, more or less.
Yeah.
But after we've been speaking to Adele's private doctor, he said there's a good chance possibly are. So we took Caitlin to Germany when we first went there, and we had her tested while we were over there, and she was positive for Lyme. And a couple of other things, so she's been on treatment.
I picked up on from watching the video that you put together, I think it was last year, was about exactly that, and the cost, obviously having 3 children and yourself that's not been tested, you could only really take one of them to get those tests done financially, money-wise.
Yeah. Well, it's mainly because with these private doctors, you have to book in advance, and there's quite a long waiting list. So we kind of booked it, and whatever money we had at the time was what we had to go with. And at the time, that's all we had the money for.
Right. And so that meant selecting one of the three effectively, didn't it? And you went with Caitlin because her symptoms were kind of marginally worse than the boys.
Yeah.
Yeah, right. But I think the other thing is, if it has been passed on to children, I believe that as they reach sort of puberty age, that's the time that they're increasingly vulnerable. Is that the right word?
From the research we've done ourselves and speaking to a couple of doctors, that is generally the case. But we just don't know, and that's why we want to speak to the experts.
Yeah.
See, private experts cost money, and that's what we're raising money for.
Absolutely. And what ages are the boys at the moment?
Oldest is 11, youngest is 4.
Right. So 11. That's quite sort of that's the time. It certainly was for me. Getting to that sort of age, that there's quite a sense of urgency there, isn't there?
Yeah.
So, I think the other thing I wanted to mention was obviously you're living with family now, aren't you? Just wanting to chat about the things that you've had to sort of sacrifice in order to get to where you have so far.
Yeah, well, to pay for the initial Germany trip, and to help pay for ongoing medication and tests, which we had to do at the German clinic. We couldn't afford to keep the house we were living in, so we ended up giving up the house, and we had a big house sale. We sold loads of stuff, sold some kids' stuff, our own stuff, and we moved in with my in-laws, and we've been living with them more or less since then, just so we can fund as much as we can ourselves.
Yeah, right, absolutely. And I think that must be quite difficult anyway, to give up that level of independence to then be
yeah, definitely.
not necessarily reliant on somebody else, because obviously it's very humbling that they'll do that. That's great. You wouldn't want to be sort of unhappy about that, but it's just the level of independence that I believe anybody really wants.
Yeah.